Hey everyone, Veronica Ogbe here, and I am joined by Dr. Leigh and Dr. Connor. Thank you both for joining us here today.
Yes, thank you.
Amazing. So, when thinking about chiropractic work, what you guys specialize in is so unique. Talk to me a little bit about what it is.
Yeah, so we specialize in a chiropractic technique called NUCCA. So we go to the very top bone of the neck and do a very precise alignment there, taking as much pressure off of the nervous system as possible so the brain can communicate better with the body. So we don't pop, twist, or crack the spine. We go to that very top area and do a very precise alignment there.
For sure. And I see you're holding a little bit of a display here.
Yeah.
Tell us what it will look like essentially when someone comes in, what their neck might look like before getting aligned.
Yeah, so before we even get aligned, we want to make sure that this atlas is out of alignment first. So we actually do a thorough history and exam to determine if somebody is misaligned. And if they are, that exam will tell us that this top bone of the neck, so this is the base of the skull here, and this is the top bone. It sits right below the base of the skull. You can almost feel it behind your ear. That little bone there is right below that side. So when that top bone misaligns, it actually can misalign pretty complexly. The atlas is this ring-shaped bone, and it can move in multiple directions. So it can actually shift, twist, and tilt out of alignment. So we actually have to figure out exactly how that bone has misaligned so we can precisely correct it. If you look at this model here, so this is the base of the skull. The brain sits right in here. The brain stem is right in this space, and the spinal cord, or basically everything your brain tells the rest of the body, all of those nerves, all of those messages have to pass right through this hole, right through that top bone, going all the way down the spine. So depending on how this top bone is misaligned, again, it can shift, twist, or tilt out of alignment. But you can see how when it's misaligned, that space in there becomes smaller. And whatever nerves that's pressing on, they're not able to function as well as they're supposed to in the body, which can create a wide variety of symptoms and just preventing the body from performing at its best as well.
Wow, so interesting. My neck, I'm like, it's kind of hurting thinking about that. Oh my gosh. So before people come in, if they aren't sure they need chiropractic work, what are some signs that they can look for?
Yeah, there's the obvious things like, oh, I have a problem, I'm having some symptoms. There could be some less subtle things though, like one, if you know or have observed that you have a leg that's shorter than the other leg, that's a very common one we see. Or if you're just like, wow, I always seem to be really tight in my neck or my low back, that's another very, very common one. Obviously, like I said, some of those more, like if I have pain, if something's really bothering me, yeah, that's definitely a sign. But there's definitely some more of those subtle things that I just talked about that are a good indicator that you could benefit from our care.
I'll add to that as well. So if you are trying to get to the source of your problem, you've been through a variety of therapies, tried different medications, supplements, just to help with your acid reflux or digestion, and you're eating a clean diet, you're exercising, but you're still having digestive issues, that's a sign that something's not working right inside your body. It's not a sign that you necessarily need to be doing something differently, but that's a sign that the brain's not communicating properly with those organs, which is a great indication to come in and get evaluated and see if we can help. And the other thing that I can say too is if you're noticing your head tilting to the side often throughout the day, or if somebody says one of your shoulders looks higher, those are obvious postural measurements that can determine that you do have something going on inside that's not quite right. And those symptoms that you experience can be very mild. It might just be something like my neck doesn't feel right, but it can also be very severe, like chronic fatigue syndrome, fibromyalgia, chronic ailments of any type. And I talked about digestion as well. That's actually a common symptom that our patients notice relief with being under care.
Wow. And a lot of that also being things that you notice that are physical. Is there anything when it comes to the mind, stress, things like that, that also may be a sign?
Yeah, definitely. If you notice that you have, say, trouble focusing on a task, or you're like their brain fog, things just aren't very clear, even trouble getting to sleep, staying asleep, definitely some of those more mental aspects that you might not tie in. Yes, we see a lot of people with that. They get a lot of great benefits from our care.
Wow, that's so cool. And then also, we were talking before, there aren't many people that are doing NUCCA, which is so fascinating. Tell me a little bit about how many people and, you know, the process to even get into a practice like this.
Yeah, so there's actually only 250 NUCCA chiropractors in the world, so there's not that many, and there's 3 currently in the whole state of Tennessee. 2 are in the Nashville area, and we are here. But prior to us moving here, there were only 2, and both in Nashville. There's some states like Kentucky that don't even have a NUCCA practitioner out there, so our average patient drives over an hour into our office to get this type of care. Now, to answer your question further, the reason why it's really difficult to find a NUCCA practitioner is it's a tough process to learn this type of technique. So in traditional chiropractic, you can feel how that top bone might be misaligned and add a force to return it back to its normal position. But in NUCCA, we're looking at this area with such detail and measuring the exact degree that it's twisted, shifted, tilted out of alignment, and calculating a specific vector to open up that space around those nerves as much as possible, taking as much pressure off of that so your body can communicate properly with the brain again and work the way that it's supposed to. There's a whole level of certification to go through to be able to practice this technique as well. So it's not a weekend seminar, it's not something that you can learn in a short amount of time. It actually takes years to become certified to go through this process.
Wow, a lot of good stuff there. Well, for more information, where can people go if they want to stop by?
Yeah, so our website at transcendchiro.net is a great resource full of more information about what we do, other conditions we help with, and more about us.
Awesome. Well, thank you both so much.